Yes, we can now start the meeting. We have been joined with by our manager as well. So, Vandana ma'am, can you just unmute your mic once so that we can have a quick mic check?
Yeah, sure. Sure, Siljo.
Okay, ma'am. It's clear, ma'am.
Okay.
We already had a mic check for everyone. I hope we can start the meeting now. So, I would like to just once again welcome everyone to the COVID-19 Academy's launch event and coordination meeting, Meghalaya. So today we have been joined by an esteemed set of speakers from the Revenue Department, our Commissioner Ma'am, Meghalaya State Disaster Management Authority, Directorate of Health Services Meghalaya, UNICEF, World Vision India, and also Bethany Society. And apart from that, today we have representatives from various government departments, NGOs, CBOs, faith-based organizations, and community volunteers from around the state who are involved in this humanitarian field. In one line, I would like to welcome each and every person who took out their precious time for this COVID-19 Academy's launch event and coordination meeting, Meghalaya, organized by Spear India in collaboration with the Meghalaya State Disaster Management Authority and the Directorate of Health Services, Meghalaya. Today, I have been also joined by our manager, knowledge and capacity sharing team, Ms. Vandana Chauhan, who would be moderating the entire session. Now, I would like to request Ms. Vandana to share the introduction and objective behind today's meeting, and would also request you to take the session forward. Over to you, ma'am.
Uh, Thank you so much, Siljo. And our many thanks again to the Commissioner ma'am as well as the Meghalaya State Disaster Management Authority for, again, this is one of the important event, and again, the state has been supporting us to organize it in a such a systematic way. So thank you so much for all the kind support to my colleague Siljo and to my organization. So just to start with, I just wanted to briefly introduce you again about the organization and the objectives of today's meeting. So Sphere India is a national coalition of the humanitarian agencies in India. We have a membership comprising of 90 nodal national agencies from government, from corporate sectors, from UN agencies such as UNDP, UNICEF, UNWFP, World Bank, NGOs, international NGOs, and volunteer networks. We also, in total, we have a pan India presence through our state networks, which are known as interagency groups. And we have 805 associate member organizations. They are mapped district wise. So we feel that we are a fast growing institute, well acknowledged for our unique role in coordinating different stakeholders for disaster preparedness, for response, for risk reduction, for climate risk and resilience building. And we are also known for establishing the quality and accountability standards as part of Sphere Association globally. So, and in terms of our role, mainly we have been working in terms of effective policy development for humanitarian as well as development sector, the knowledge management part in terms of humanitarian sector, capacity building, and nurturing collaborations at various levels. So yeah, so that's how Sphere India work at a national level. Now, in terms of today's meeting, actually, we've initially we had planned, and this was 4 5 months back, but we came up with an idea to the state to organize the academy. Why we call it academy? Because if we call it a training program or so, then it is done just once, and then it get over. But in terms of academy, we wanted to run it for more than once, which means 5 times 10 times, for 3 4 months constant program, under which various level of people, for example, frontline workers, the the middle level staff of the government institutions, the NGOs, the CBOs, the FPOs who have been working in the state, the corporate sectors as well. So that we thought that, and this was idea about, to generating awareness in terms of basics of COVID and what is done, what is not to be done, etc. But now, at this point of time, we felt that now almost that period is over. But we had a discussion with Ministry of Health and Family Welfare at national level, along with National Disaster Management Authority. So we got a suggestion that at a state level we should support state to generate awareness among the frontline workers and the volunteers in terms of, vaccination rollout for the COVID-19. So that's why, we thought that, okay, let us now, that's very important, and that's the national government agenda. So let us, and it's not only the national agenda, but yeah, at state level also this is happening. So so that is one of the main objective of today's meeting, that we thought that let us do a proper launch of it, and then we will have 2 to 3 sessions on vaccination rollout in the state to generate awareness in terms of COVID-19 vaccination. So that's one of the objective. The another objective of today's meeting is that, the state is having many organizations, like NGOs. When I say organizations, means NGOs. They have been working in the state either in the humanitarian sector or in the development sector, or in both the sectors. But the thing is that, they have been working with their mandates and with their own agenda. But and I'm sure there must be having some coordination, geo NGO collaboration kind of work there. But still, while we had been working here, we fell we found a gap, between geo NGO collaboration. So we thought that, through a meeting today, if we can just, start thinking on, how can we strengthen the geo NGO collaboration at the state level in terms of, to work together for the preparedness of the emergency response, as well as, how to deal during emergencies as well. So so that's the second objective. And the third objective of the meeting is that, during COVID-19, people were discussing about the impact and the affected people, etc. But one more major impact, one major group which was very important, and we had to focus light on that, is the migrant workers. So what was the impact of COVID-19 in terms of, on the migrant workers? That is very important to discuss as well. So we thought that this is a right platform, and we should also, find time and get opportunity to discuss that. So these are the three things we thought that, let us plan out during today's meeting. And at the end of the meeting, if we can have a plan of action, in this direction, in terms of vaccination rollout session, in terms of migrant workers agenda, as well as the geo NGO collaboration part. So so with this, I again welcome the secretary madam, as well as the state disaster management authority, and our colleagues from the INGO as well as NGOs, and the participants of the state. Yeah. So let us now start our meeting formally. And with this, I would now like to invite Dr. Y.A. Fira, who is the Joint Director at the Department of Health Services. And I would like to request you, ma'am, to kindly give a special address at this launch ceremony event. So over to you, ma'am. Fira, ma'am. Thank you. Hello, Siljo?
Yes, yes. Can you
Okay,
hear
ma'am.
me now?
Yeah. We can hear you. Yeah.
A very good afternoon to
Yeah. Good
everyone.
afternoon, ma'am. Yeah.
Yes. Madam R. Lingdo, Commissioner and Secretary to the Government of Meghalaya, Revenue and Disaster Management, and all esteemed speakers and other participants at this function. On behalf of the Health Department, I am happy to be a part of this initiative by Spear India in collaboration with SDMA Meghalaya to impart training in local languages, Khasi and Garo, on COVID-19 and COVID vaccination rollout. Indeed, more than 10 months have passed since the first case of COVID-19 was diagnosed in our state, and we lost a very renowned doctor. And I must say, we have come a long way since then. Till 24th February 2021, that is yesterday, the number of people tested for COVID-19 in Meghalaya is 3,64,517, out of which confirmed cases is 13,958. Out of these, 13,792 persons have recovered, and we now have only 18 active cases, and a total of 149 people have died due to COVID-19. District-wise, the highest number of confirmed cases is in East Khasi Hills district at 8,674, out of whom 8,538 cases were cured or discharged from hospital or the corona care centers. The timely setting up of multiple corona care centers and quarantine centers in the state, with the help of the administrative departments and the community at large, played a major role in containing the disease. Besides which, we have also set up COVID laboratories in Shillong and Tura and Trunat testing centers in all districts of the state, which have catered to the demand for testing of many people who were exposed to the infection. Though our state has seen a significant drop in the number of cases testing positive, we cannot afford to be complacent, as this very day we are seeing a huge rise in COVID-19 infections in other parts of the country and globally. Thus, vaccination is the need of the hour. As per guidelines from the Government of India, the vaccine will be rolled out in a phased manner across the country. In the first phase, people who will receive the vaccine are first the healthcare workers, government and private, next the frontline workers, police, home guards, municipal workers, etc. Then the people who are above 50 years of age and those below 50 years but having comorbidities. For receiving the vaccine, a beneficiary has to be registered using a photo ID in the COVID app. The Government of India has already cascaded the trainings, and even our state and district trainings for vaccinators and teams are complete. Now, COVID-19 vaccination rolled out in Meghalaya with the dry run. The dry run exercise on COVID vaccine rollout was done for Meghalaya on the 2nd of January in two districts, that is in East Khasi Hills and West Garo Hills districts. The launching of the COVID-19 vaccination for healthcare workers in Meghalaya was on the 16th January 2021 with 10 session sites and one site in Negrims with two-way communication. On the launching day, prominent doctors from Negrims, that is the director, medical superintendent, staffs, and sanitary workers were vaccinated. Till date, 31,062 healthcare workers and 43,071 frontline workers have been registered in the COVID app. 1,042 sessions have been conducted so far across the state, and 16,915 healthcare workers and 19,674 frontline workers have received vaccination. Therefore, 49% of the total healthcare workers and frontline workers have received the first dose of Covishield vaccine. Vaccination of healthcare workers for the first dose is over, and 28th is the last day of vaccination of frontline workers. After the third phase will start, wherein the 50 plus age group will receive the vaccination. We have encountered a lot of refusals amongst the healthcare workers, which also includes the Ashas and the Anganwadis workers. Sensitization and counseling is being done to clear their doubts and queries. Which is why this initiative by SPEAR India, in collaboration with SDMA Meghalaya, has come at the right time to address the COVID-19 vaccination rollout, because we have seen so many refusals. We are indeed thankful to the lecturer cum demonstrator of the Regional Health and Family Welfare Training Center, Dr. C. Yang Rai, and the training consultant, National Health Mission, Dr. S. Karkongor, for readily agreeing to carry out the trainings for outreach workers and volunteers in order to sensitize them to the correct approach, in order to approach within the context of COVID-19, and especially to increase the awareness of people about the COVID-19 vaccine and how it can protect us. Now that we are seeing a rising trend of the disease in many states of India, our focus is to speed up the vaccination so that we are able to vaccinate as many people as possible and reach herd immunity. I hope people understand that as of now, we are looking at the vaccine in anticipation that this will end the COVID-19 pandemic and we can revert back to the normal life as we know it. I wish the endeavor of SPEAR India a grand success. Thank you.
Hello?
Hello, yes?
Yeah.
Yes, ma'am.
Yeah.
Yes, ma'am.
Hello? Yeah. So thank you so much, Pam, for your important and very fruitful address. I mean, you rightly mentioned about awareness generation on vaccination rollout, which is one of the priority agenda of the state, and we will be happy to support you in whatever manner you want us to support you and your kind office. We will be definitely there. Thank you so much, ma'am. Let us move forward, and now we would like to invite Dr. Keshav Sharma, who is the consultant at UNICEF. So over to you, Dr. Keshav Sharma, for special address by you. Hello.
Okay. Thank you, ma'am. Vandana ma'am, can you hear me?
Yes, sir. We can hear you, sir.
Okay. As already mentioned by the Dr. Fila ma'am, what is the status about the already there is a COVID-19, and if we see the vaccination totally across the India, it's almost 1 crore 25 lakhs people are being vaccinated already. In Meghalaya, we see almost around 41,000 people are being already vaccinated. So in terms of the people have so much of efficacy and other issues doubt on it. So I think this COVID-19 academy will be able to help kids to reduce those are the gaps and those are the confusion which are there among the people. So it will help them to through this COVID-19 academy. It will help them to clear their doubts and everything. Another area people need to understand is opportunity. That what we want to convey for the people who are having a confusion or who are having a little bit doubts about the vaccination. We are among. Okay. So like the people who are having a doubts about the vaccine, efficacy and vaccine probability, if we see over vaccination, which we have achieved, in India, out of which we have achieved in India, out of which we see maximum number of the cases, very minor of them are minor AFI being reported. There is no serious AFI, no severe AFI is being reported across the India. So this is, and these minor is nothing to fear and nothing to resist about it. So the main thing is information gap. So this COVID-19 will help you to have to bridge those information gap, which because of those information gap, uh, so many rumors are being circulated among the different social media. So we need to understand the cost which we are going to pay because of these other fake news and other social media news which are not rightful. So whenever you refer the news, please refer the exact source of information so that you get a exact idea about the vaccination. On Ministry of Health and Family Welfare also have come up with the link where you can see how number state-wise you can see the number of vaccination purpose which has been done. You can see the state-wise vaccination.
I believe he got dropped out in between as he
Yeah, yeah.
might have seen
Actually,
he.
his voice was breaking, Siljo.
Yeah, he was actually traveling. He's in his field visit, so he already informed me about this. Maybe, ma'am, we can move on with our next panelist. Meanwhile, we can have him after this. At the end, we can have him.
Yeah. Yeah, sure. Thank you. Thank you so much. But you know what I understood from whatever Dr. Keshav Sharma was emphasizing was, I think the role of media in terms of, awareness generation on the vaccination rollout, because media, I think he was trying to tell that, we should be, people
Yes,
should
he.
be careful in terms of rumors against the vaccination, and for that media can help us to do so. So I think that is what I could capture.
Yes, he's back, ma'am. He
Yeah.
has joined.
Okay, hello.
Dr. Keshav, can you hear me? Dr. Keshav?
Okay, so can we move on then?
Yes, ma'am. Let's move on then.
Let's move on. Okay, so now we would like to invite Mr. Carmo Noronha. He is the executive director at Bethany Society, and he will be
We lost your voice in between. Vandana, ma'am, we lost your voice.
can you hear me?
Yeah. Yes, yes, please.
Okay. Okay. So I just wanted to invite Mr. Carmo. He is the executive director at the Bethany Society, and he will be talking on impact of COVID-19 on migrant workforce. So over to you, Mr. Carmo.
Hello, good afternoon, everybody. Good afternoon,
Good afternoon, sir.
Air India and all the government departments. Thank you so much for inviting me. I'm from Bethany Society. I will speak for about 4 or 5 minutes, and if possible, if I can share my screen, I have about 4 or 5 slides. Is that okay?
Yes, sir, sure.
Yeah. I'll let you know when I'd like to make to share my screen. But first of all, I also want to say that I'm really not an expert on migrant labor, etc., and so on. We are an NGO, so but I think it's a very, very important and relevant point, especially when it comes to a disaster. But having gone through information and so on, as far as Meghalaya is concerned, I mean, across India, official figures say that about 125 lakh migrants return to their states. And when I looked at the numbers for Meghalaya, it was about 4,000, a little more than 4,000, about 4,300 that returned to the state. So considering that nearly 60% of our workforce are youth, that's a small number. I'm not saying they're important. So I would like to look at migrant returning also from the point of view of inter-district and intra-district migration. And I think that is very, very important for us. And I do know that the government and the government can speak on that, have taken various initiatives to make sure that all these people coming back have some sort of relief or rehabilitation. But at the same time, I also want to say is that while focusing on those that have come back into the state, perhaps we have lost the focus on those people that migrated from rural to urban centers, or people who are migrating. You know, that number is 100 times more. So particularly in times of disaster, we need to look at that. Just the other day, one of our ex-students walked in, and I asked him where he was, and he's from the Jaintia Hills. And he told me that for the last 10 months, he was in his village. He returned from Hyderabad, but he's totally blind, but he's actually a team leader working in Accenture. And he's one of the lucky guys. He was in his village, but he's working from home. And then I realized that there were more than 150 of our people who have gone through Bethany, who are either visually impaired or hearing impaired, who are actually scattered all over the countryside. So the impact, when I come to impact, what I want to say is there are three major things. You know, why do people move? One, of course, is opportunities, lack of opportunities. So the impact is the same. When they come back, they have a lack of opportunities. So here is where I think it's very, very important. And everybody's looking for a government job. There are no government jobs. And we have very few industries. So livelihoods, availability and opportunities for livelihoods, to me, is one major area that we need to work together in. I would also like to place before the august audience that there are two major pandemics or disasters that we are all into, which are much greater than COVID. And one is mental health. And that is irrespective of COVID, because many of the migrant people coming back are facing severe mental health issues, besides those that have experienced COVID within the state. So mental health is going to be a very major issue. And as per WHO kind of statistics, 1 in 3 will require support. And the other major disaster that we are looking at, and we need to prepare for it, is a climate change. And because that is going to impact livelihoods, since almost 80 to 90% of our population is in rural areas. So this again is going to be a major impact for us. And you know, we are all focusing on enterprise and enterprise development. And so for enterprises to work, we need to start off with the market. And if government and people don't come together to collaborate on the market, we cannot have sustainable enterprises. So I just wanted to flag these 2 or 3 major issues and look at migration, not only those that are outside the state, but also migration from rural to urban and inter-district and intra-district migration. These are major issues. In this short time, we cannot take a thing. But can I just focus on 4 or 5 interventions that I'm most comfortable in speaking about, and that is on what we have done. And can I request that I share my screen? Yeah.
Sure, sir. Please do.
I'm just sharing my screen. Um, can you all see it? Yeah.
Yes, you can just full screen it once.
Yeah, I'm just trying the. Can you see it? Yeah. Hello, can you see my screen?
Yes, sir. Yes, sir.
Yeah,
Yes, sir.
okay.
Yes, sir.
So that's the first one. Every one of us will die, but that's not a very uplifting thought. But so few of us really live. And I think that is the overall impact of COVID on many of us, and particularly on migrants. And just to give you a quick thing, this is a slide that kind of focuses for us also what migrants should be doing. And as an organization, our focus is on humans and earth fully alive, and particularly in the context of Meghalaya, where the environment and the earth and our forests are such important parts of livelihoods. And so, I mean, being an organization that works a lot on disability, our tagline is "We only segregate garbage." That's very, very important for us. And when we look at human beings, the importance of inclusion when it comes to people, especially people with mental health issues. Okay. And this is just a quick thing over here. But what I want to say is that whether it comes to COVID, or whether it comes to livelihoods or migrants, these are the four important things that are very, very important. Partnerships, creating opportunities, ensuring that we work on security of health and food and livelihoods, and finally, in terms of the Sustainable Development Goals, sustainability. Okay. And this is, I'm just showing you a picture of collaboration. These are, I mean, I think we have to learn from children in schools. These are two young people. The little boy on the left is deafblind. He cannot hear or speak. And the other boy is also deafblind, but a little less. But the boy on the right, his first focus was, let us, and this he did on his own, and I took this picture very quietly maybe 2 years ago, where his major focus when there was a party was to ensure that the boy who was left behind was getting his share of food. Okay. And my last slide is this one, and that is that if we are working on any program, then a twin track approach is very, very important. And over here, I mean, I've used disability, but here is a group of young blind people in the Garo Hills. They are being taught how to move around, and to develop their skill. But the point is, they cannot use their skill unless there is a good road. And here are the two things that need to come together, is that when we are looking at migrants and people coming back and livelihoods, one is to develop skills, and the other is to bring about change in the system so that those whose skills are there can become part of the system. And that is what we call a twin track approach, where you look at systemic change and you also look at change within individuals. Okay, so thank you very much. I'll stop sharing, and that is what I wanted to share. I hope I've just covered my 10 minutes. Thank you very much. Hello?
Yes, sir. Thank you. Thank you, Mr. Karmo. Thank you so much. Hello?
Yes, ma'am, we can hear you.
Yeah. So, yeah, thank you so much. I think what we understood from your presentation in terms of, as a next plan of action in terms of migrant workers is that We need to do a partnership. We need to collaborate. We need to, make sure that food has livelihood and shelter reaches to everyone. And I think the sustainability aspects of whatever, we plan for the migrant workforce. So thank you so much for emphasizing on all these aspects, sir. So let us move on, and we would like to now invite Mr. Maran Nampui. He is the Senior Manager of Northeast Zone at World Vision India, and he will be speaking on strengthening interagency coordination, Meghalaya. So over to you, Mr. Maran.
Hello, can you hear me? Am I audible?
Yes, sir, you're audible.
First of all, I would like to thank Sphere India for this wonderful initiative and giving us this privilege to be part of this webinar and share few points from World Vision India. I am Meran Nampui, Senior Manager from World Vision India, based here in Guwahati. And we have project in Meghalaya for the last more than 20 years. We have been working in Meghalaya, East Khasi Hills district, in focusing in Maukinriu block. I would like to start my sharing with a short video clipping, and I hope you will enjoy watching this video clipping. This is basically about World Vision intervention during the COVID pandemic. Can you see my screen? Hello,
Yes, sir. Yes,
can
sir.
you see my screen?
Yes, yes.
Okay, thank you.
The lockdown to curb COVID-19 has put a strain on many communities. Here in Anand Parbat, the community of rag pickers have got their livelihoods completely on hold. Luckily, World Vision India has come forward to give them the rations they need to live a life of daily dignity. Asha is a new mother. Her baby is just 12 days old. No one in a family of 5 has been able to work during the lockdown. The entire family of 7 who share the small room are dependent on the rations provided by World Vision to survive.
हम तो बच्चों का पेट कबाड़े वाड़े से पालते थे, कबाड़ा वाड़ा चलते थे, वहाँ उतने परेशानी नहीं थी। जब से लॉकडाउन लगा ना, जब से सारा काम बंद हो गया।
Asma is a patient of tuberculosis. With the lockdown, the family of 5 was desperate until World Vision came along.
दीदी की मरीज हमारे घर में कोई कमाने, एक दिन हमारे घर आदमी गया था कमाने के लिए, तो पुलिस ने मारा उसने।
Every day, their income depends on daily wage laborers. And now, during the COVID-19, none of them are getting any income. So the livelihood is a big challenge for them. So World Vision has helped them with a package, a food package containing of rice and atta and dal and oil. And hopefully this will sustain them for some time. Selfless efforts of many organizations like World Vision India have ensured that communities like this one here at Anand Parbat can survive during the lockdown.
Yeah, the topic that is given to me is on strengthening coordination with various stakeholders. And we have experienced during this COVID pandemic that many stakeholders came forward and responded to this crisis. And even in Meghalaya, we have seen a lot of NGOs, civil societies coming forward and doing whatever was possible. And we, as World Vision, did whatever was possible, especially focusing in Maukinriu block in East Khasi Hills district. And when we look around, we see a lot of stakeholders, uh, civil societies doing their work very well, but when it comes to partnering with one another, when it comes to working together, having a better coordination, this was one thing that we thought will be good to improve in Meghalaya. So the idea of forming interagency group was also recommended. Even in the previous webinar, we have recommended for having a very good uh, interagency group for Meghalaya state. And if we can come together, we can do much, much better. And I have also shared the experience from Assam, because I am also one of the executive member of interagency group here in Assam. And in Assam, we have been responding to disaster like flood, recent flood, and also in the other hand, COVID. And we were able to come together as civil society groups and also work along with the SDMA, which was very, very effective. And I am very sure if we move ahead, uh, uh, trying to work together as civil societies and also work along with SDMA, I'm very sure we will be able to do much, much better than what we have been doing in the past. And I am very sure all of you might be knowing what World Vision has been doing in Meghalaya, and just want to take this opportunity to inform all of you that we have recently initiated another project at Ribhoi district at Boringbong block. And these are the two projects that is going on in Meghalaya. And I would look forward to have a very good interagency group whereby we as a civil society groups will be able to take part more actively and be able to do good work for the people of Meghalaya. Thank you. Thank you so much.
Hello.
Yes, ma'am.
Yeah. So, thank you, Mr. Marin, for putting light on how to strengthen the geo-NGO collaboration. Maybe at the end of the meeting, we can, again emphasize on, what are the concrete actions, one or two concrete actions as a way ahead of, this important work, which is geo-NGO collaboration at the state level. So thank you so much. So now the very important part of the session is the inaugural address, which is to be addressed by Madam R. Lindo. She's the Commissioner and Secretary to the Government of Meghalaya Revenue and Disaster Management Department. So, Madam, welcome, and over to you for the inaugural address.
Good afternoon. Am
Very
I
good
audible?
afternoon, ma'am. Yeah. You are very much audible. Yeah.
Well, at the outset, I must thank you, Vandana and Sphere India, for giving us the opportunity to interact. In fact, a lot of people are doing good works in Meghalaya, which has come to light through this forum. In fact, we were so pressed with work that when one of your officers tried to talk to us, we were sort of shifting, the burden from one to the other. But at the end of the day, I'm so glad that you have triggered a lot of important things in us, which eventually through Abraham, coming off and on to Shillong and to my office, meet my executive director, we have been able to come to the launch today. I fully agree to what Mr. Carmo had been mentioning during his discourses. And I thought that there are certain issues which needs to be addressed but it is not within the mandate of revenue. But I can always refer to the right department of the government, which deals with skill, livelihood, and sustainability, and which has been doing a commendable work, especially during the pandemic. Well, we are all aware that India is vulnerable in varying degrees to a large number of natural as well as man-made disasters. As stated in the National Policy on Disaster Management 2009, in India, 58.6% of the landmass is prone to earthquakes of moderate to very high intensity. 40 million hectares, that is 12% of the land, is prone to floods and river erosion. Of the 7,516 kilometers long coastline, close to 5,700 kilometers is prone to cyclones and tsunami. 68% of the cultivable area is vulnerable to drought, and hilly areas are at risk from landslides and avalanche. Vulnerability to man-made disasters and emergencies of chemical, biological, radiological, and nuclear origin is also on the rise. Heightened vulnerabilities to disaster risk can be related to expanding population, environmental degradation, unplanned urbanization, industrialization, within which hinders the country's growth. The management of response in disasters requires the existing large number of tasks. The activities involved in response management would depend on the nature and type of disaster. It has been observed that in times of disaster, apart from lack of resources, lack of coordination, as mentioned by Mr. Nampui, among various agencies, and absence of role clarity amongst the various stakeholders pose serious challenges. If the response is planned and the stakeholders are trained, there will be no scope for ad hoc measures, and the response will be smooth and effective. Our state, Meghalaya, is a multi-hazard prone state with high susceptibility to disasters. The government of India has declared COVID-19 as a disaster, and Meghalaya, like the rest of the country, has been experiencing the impact of the pandemic over the past year. The COVID-19 pandemic has exacerbated the vulnerabilities of the communities by affecting the community's abilities to have adequate access to essential services and means to sustain livelihood. With the persisting effect of the COVID-19 pandemic, there is a need for education, a need for knowledge sharing on the virus. With the rumors that followed the virus, wrong information, like what Dr. Fira was saying, misguiding news leads to stigma and social isolation among the community. In terms of eliminating stigmatization associated with COVID, it may not be too late to look at what COVID-19 is all about and how to stop stigmatizing and learn in a correct manner in which we are to respond to this pandemic. It is within the interest of all that the capacity of the state be strengthened to effectively respond to COVID-19 pandemic. It may not be out of place to mention that the NGOs of Meghalaya, with such a huge task on their hand, had done a commendable job in rallying around supporting the government, giving, the role of every headman, every nokma is to be recognized, because they were the loudspeakers, they were the mouthpieces of the government, which had been able to, to commute to the people what this is all about. And there shouldn't be panic, no fear in the minds of the general populace. The three non negotiables, like wearing a mask, social distancing, and hand wash, application of sanitizers, are all the efforts of the NGOs, of the local darbars, the community in general, where we see till date the habit is being practiced. Uh, I would also like to mention that SDMA at that particular point of time has been caught unaware. We had to activate the State Emergency Operations Center with very few staff. But thanks to the people of Meghalaya, volunteers, young people came forward, educated, uh, neoliterates came forward to help in whatever they can to deal with the pandemic. Some of them have been trained to receive calls, to give adequate information, where to get the information from, whether it's from the health department, whether it's from the how to go about to get a 108 ambulance. These are all the contributions of the volunteers and young people of the state, of which I would like to place on record my deep appreciation, my gratitude to all of them. In this light, the Meghalaya State Disaster Management Authority, in collaboration with the Department of Health Services and Sphere India, is pleased to launch the COVID-19 Academy in Meghalaya to achieve mutual goals of developing a skilled workforce in relation to the overall management of COVID-19 in Meghalaya, as well as other factors, as well as other sectors perhaps, which we perhaps may think in the near future. And through this venture, I am fully confident and hopeful that we would be able to develop a progressive strategy in dealing with disasters. With these few words, I thank each and every one of you present here and hereby launch, inaugurate the COVID-19 Academy of Meghalaya. Thank you. Hello, Vandana.
Yeah, ma'am. Yeah. Thank you so much. Actually, I am so encouraged with your speech. Yeah. I mean, I'm so happy that you have formally launched it. Really. And thank you so much, ma'am. So happy. And the state is, yeah, really, fortunate to have leaders like you, who encourage and, yeah, inspire us to work in the state. So, yeah. So thank you so much.
Thank
And,
you. Look forward to meeting you also personally and to
yeah,
interact with
I
you.
will be happy. Yeah, I'll be happy to come and meet you,
You have to
ma'am.
guide
Sure.
us. You have to take my people forward, and
Yeah,
together, I
absolutely.
think we'll be able to,
Certainly,
you know,
certainly,
create
ma'am,
a team.
certainly. Yeah, thank you so much. So, I think what we understand, ma'am, is that now from this launch event as a takeaway, there are 2 to 3 things. One is that, of course, we will have now a series of training programs in terms of, awareness generation on vaccination rollout. So that's the one thing. The second thing where we would like to have, your time again, not much, but maybe 10-15 minutes, but, just to, work more on, how to strengthen the geo-NGO collaboration, because we understand that many organizations, they have been working in the state, but not, in a coordinated way. So it's very important to deal with the government and to strengthen their to strengthen this collaboration, to use the systematic way of the expertise of, each other. That's very important. So, yeah, so that's the second takeaway I was thinking. I understand that we will do, and my colleague Siljo will definitely follow up on that, and will come to you with the proper action plan and the proper activities on it to discuss with you. Yeah. So thank you so much, and over to you, Siljo, now for the vote of thanks.
Thank you so much, Vandana ma'am. So before moving ahead, do we have Dr. Keshav who want to speak to some talks, as we were missing him in between? I hope he's not here again. He already informed me that he was in a field visit and he would be traveling. So, anyways, I would like to conclude this meeting with delivering the vote of thanks. So it is like an Indian pleasure for me to have this meeting here hosted in the state of Meghalaya. As the Commissioner ma'am already mentioned, that we have been planning out for this since last couple of months, but due to various reasons, it was getting postponed. And finally, in Hindi, there is one term, "Dera hai durasta hai." So I'm really glad that it finally happened, and to have Commissioner ma'am on board for this launch event, it was really wonderful, and I'm really glad that Commissioner ma'am took out time to attend this entire launch event. And from my heartfelt thanks to you, ma'am, for coming here and sharing the inaugural address. And apart from that, I would also like to thank each and every single person who took out their time. All our speakers from we had one person we missed out in between, is that our Maulong ma'am, the executive director, SGMA. She's there along with the commissioner ma'am. She's always, one thing I have always seen is that she's always, though she holds various positions in the state, but she always takes up the back seat, which I have personally learned from her, working with her since last few months. So this time also she's there with the commissioner ma'am.
She's here with me. She's here with me. Yeah,
I know this fact, but she always takes up the backseat. So I'm really glad. But she is the one who puts up all the efforts to function and implement all these programs. So thank you so much, Maulong ma'am, and also Legia, the DM consultant, who is along with her, for taking out the pain and for all hard work put in the background. Apart from that, we are also joined with the Vivet Fira ma'am. The joint director health services MI. So she's also there with us in arranging everything since the beginning for all the resource persons and all those things, along
Yes,
with
Siljo, 1 minute. Actually, Dr. Yangrai is here with me. She was the one arranging everything.
Yes, I was going to take the next name of Langrai ma'am's name only. So since the time I came here, Yangrai ma'am, she was there with me to plan out everything for the resource person. Earlier, we were planning to have the 10 modules. Now we reduced it to 2 modules. And the coming month, we would be having these 4 sessions on the COVID-19 and also on the vaccine rollout, both on the Khasi language and the Garo language on 2 different dates. So the dates for the same would be informed to you in the coming dates. My heartfelt thanks also to Kalinda Yangrai ma'am for organizing everything in the back end. Apart from that, we were also joined by Merin Nampoy sir from World Vision India, Karmo sir from Bethany Society, and Dr. Keshav Sharma from UNICEF. So in one word, I would like to thank each and everyone, and my manager, Ms. Vandana Chauhan, who has been my forever support in all the small to small, big to big issue and the works and everything I do. So thank you so much, Vandana ma'am. All the participants, in one word, I would like to just thank each and every single participants who came here, and especially the DDMOs who have been mobilizing all the participants, and who also mapped out the volunteers in each of the districts. I would like to thank them as well in this platform. I know it was a long word of thanks, but in one word, I would just like to thank you, and hopefully we'll meet up soon in the academy sessions as well. Thank you all.
Thank you, Abraham. Thank you so much. Thank you.
Thank you, Abraham.
Thank you, ma'am.
Lygia, all of them are here with me.
Yes, I know.
Okay. Yeah. We look forward to seeing you quickly.
Sure, ma'am. Sure.
Thank you. Thank you so much.
So,